Thank you for helping to provide oral health care to a special group of children. Did you know that patients on mechanical ventilation are still at risk for serious health conditions caused by a lack of proper oral hygiene, even if they don't eat by mouth? In this video, we will review the importance of good oral hygiene in these patients. We will also demonstrate techniques designed to streamline the practice of daily oral care, not only for the benefit of the patient, but also for you, the caregiver. Let's get started. Which of these do you think is your most valuable tool for removing plaque, the toothbrush or the toothpaste? Studies show that the motion of brushing, when done properly, is the most critical part of routine plaque removal. Before we describe proper technique, let's discuss some tips for selecting the right toothbrush and paste. The toothbrush that has soft bristles and a small head is best when caring for pediatric patients. If the brush head is too large, this could interfere with plaque removal in smaller crevices. It is important to remember that when it comes to toothpaste, less is more, especially considering paste may increase the risk of aspiration in your patients. It is crucial that you use the right amount. For patients less than 3 years old, use a rice-sized smear. For patients 3 and up, use a pea-sized amount. When it comes to flavors, keep in mind that mint flavors may be overstimulating or unpleasant to the patient. If you face this issue, try experimenting with different flavors or even unflavored toothpaste. The toothpaste you use should always have fluoride in it. In addition to the toothbrush and paste, you should always have some 4x4 gauze, a cup of water, and suction close by.
You should brush your patient's teeth a minimum of twice per day for at least 2 minutes each time. Keeping a timer close by is a great way to pace yourself. The first position is one that is comfortable for the patient and the caregiver without compromising safety. It may be convenient to perform oral hygiene during bath time. Seating the patient at a 45-degree angle is optimal. Make sure the patient's head is not tilted too far back and is stably supported to prevent them from choking. First, rinse the toothbrush to soften the bristles before applying toothpaste. When brushing, use a gentle circular motion, allowing the bristles to sweep slightly under the gum line. Be careful not to brush too aggressively, as this can damage tissue and the surface of the tooth. While brushing, think in terms of 5. Brush the top front teeth, the inside, outside, and chewing surface 5 times. Brush the bottom front teeth, the inside, outside, and chewing surface 5 times. Brush the bottom back teeth, the inside, outside, and chewing surface 5 times. Brush the top back teeth, the inside, outside, and chewing surface 5 times. Brush the middle teeth, the inside, outside, and chewing surface 5 times. Brush all around the outside surfaces 1 more time. And finally, gently brush the tongue. When brushing, place a 4x4 gauze on the opposing surface of where you are brushing to help collect any residual toothpaste and to prevent any toothpaste from entering the throat. After brushing, use the gauze to wipe the residual toothpaste off of the teeth. Finish by moisturizing the mouth with a wet gauze wrapped around the finger. This is an important aspect of oral care for patients on mechanical ventilation, as they are more susceptible to dry mouth. Having a systematic approach to brushing can help ensure that you don't miss any surfaces and makes it easier to brush for the minimum of 2 minutes.
Remember to be gentle and take your time. If possible, involve the patient in their oral health routine and try your best to make it a pleasant experience. Remember to keep suction close by at all times and closely monitor the patient during brushing to ensure that they do not choke. Be conscious of the state of your patient's oral health each day. Make sure to take note if there are any abnormal patches or bumps in the mouth. Also, be on the lookout for loose teeth, as they can pose a possible aspiration hazard.
In summary, despite the fact that many of your patients do not eat by mouth, proper oral hygiene is instrumental to their overall health. The bacteria that accumulates in the oral cavity can lead to plaque, gingivitis, periodontitis, and tooth loss. Bacteria can also accumulate on the tongue. Without proper removal of this bacteria, your patient is at an increased risk for infections such as ventilator-associated pneumonia. When it comes to removing plaque, the proper use of the toothbrush is the most crucial part. Be sure to use the appropriate amount of toothpaste and brush twice daily for at least 2 minutes. Remember the 5s of toothbrushing and wipe off excess toothpaste with gauze. Keep suction close by and pay attention to your patient's positioning to prevent a choking incident.
We hope this video has been helpful and that we've provided tips you will find useful in your daily routines. Proper oral hygiene for patients that rely on mechanical ventilation doesn't have to be complicated or cumbersome. A simple, relatively quick routine, when done with the right technique, can have a monumental impact on your patient's health.
Remember, if you see any abnormalities in the oral cavity or have any other oral health concerns for your patient, report it so that it may be examined by a dental professional. Thank you for all the work you do.